Muy buenas tardes. Good afternoon. I am Frankie Miranda, President of the Hispanic Federation. Before we begin, please note that those who need Spanish interpretation, there is a number or a link that is going to be put on the chat so you can access simultaneous translation. Antes de comenzar, si quieren unirse a nuestra línea de interpretación en español o prefieren escuchar esta conferencia en español, pueden entrar a través del enlace o el número de teléfono anotado que se encuentra en el área de chat. I am virtually joining you today from my home in New York City, one of the earliest, most tragic epicenters of COVID-19 pandemic in the United States. Early on during this crisis, we knew very little how to fight the virus, but we knew very well that our community will struggle, that our community-based organizations will have to do more, that our people will become essential, but also disposable in the eyes of so many. It has been a long year, and we have so much to reflect on and look forward to getting our communities and economy headed in the right direction on the long, tough road of recovery. I want to thank all of you for joining us here today for this important summit to discuss the economic impacts of COVID-19 on our communities, on our Latino communities, as well as dive into some of the provisions in the recently passed $1.9 trillion American Rescue Plan, which is intended to alleviate much of the suffering being experienced by our communities and our country, as one bill can possibly do. We are also looking forward to presenting the results of our report on overcoming economic barriers faced by Latino communities as a result of COVID-19. For the last year, our communities has been under siege. COVID-19 virus has disrupted our lives, shaken the foundations of our communities, and inflicted staggering losses, both personal and economic. And those are being multiplied by the day. We are living in an unprecedented moment in our country's history. It is precisely because of the singular historic nature of the pandemic that the Hispanic Federation and New America partner to produce the report that we are releasing today, and we will be subject of our first 30-minute panel. In an effort to help both community advocates and policymakers understand the scope of the crisis and map a path forward, we have produced an analysis of the ways in which the pandemic has impacted three critical areas for our communities: work, food, and shelter. This may seem a little basic, but we need to overcome and we need to understand the impact in our communities for basic access to these essential needs that have been deeply compromised. We are in a fight for a survival. We are in this report, we lay bare the depth of the damage done by COVID-19 and the difficult work required to bounce back. Our white paper paints a daunting report of a people who continue to do essential work at a great risk to themselves and their families, of families confronting sharp economic reversals and finding it difficult to secure the aid that they need from government, of households where hunger and food insecurity are an ever-present reality. And of course, this is compounded by the fact that Latinos account for the largest share of the nation's undocumented immigrant population. Our communities are home to millions who have spent the last 4 years in constant fear of family separation. Many will not seek essential government services for fear of having it counted against them. Add insult to injury, life and death inequities are now playing out in our community's ability to receive the potential life-saving vaccinations. The story we tell here is a difficult one because it exposes the deep structural inequities that define the nation and the ways in which they shape the lives of too many in our community. Nevertheless, this is ultimately a hopeful document that seeks to drive change. Using the collective wisdom of Latino civic leaders, business owners, nonprofits, and individuals, we lay out a series of specific policies that can help our communities recover. These are not top-down recommendations. They are proposals that emerge from the people and institutions know our communities, their communities the best. Change is possible. The recently passed American Rescue Plan is a testament to that fact. The bill provides critical support for our children and families who continue to experience alarming financial hardships, hunger, and housing insecurity. This bill will also provide a lifeline for our nation's small businesses and nonprofit institutions, will ensure millions of Americans can keep their jobs and their homes, and support and feed their families during this recovery. It will also provide an estimated $10 billion in badly needed funds specifically to help Puerto Rico try to weather the pandemic. Nearly $1 billion will go towards nutrition assistance for low-income people on the island, a lifeline of support that will reach and touch families all throughout the island of Puerto Rico, which have the highest poverty rates in the United States even before the pandemic began. The funding for programs in the American Rescue Plan, such as the increase in the child and earned income tax credit, will lift millions out of poverty. There are also billions to potentially build a community-based healthcare infrastructure instead of simply replicating the inequitable health delivery system that brought us to this moment. The program that creates and funds emergency rental assistance without the regard of immigration status will help families keep the roof over their heads, preventing homelessness and further spread of the disease. Homeowners behind their mortgages and at risk of losing their homes will also receive much needed help for a situation that was not of their making and beyond their control. However, we're also acutely aware that the funding for many of these programs will only be temporary. The child tax credit will alleviate poverty for 1 year, but what we will do after that? Will we be satisfied to see families sink back into poverty? I don't think so. At least I'm certainly hope not. We must look forward to and advocate for an inclusion in the next bill. Our inclusion in the next bill is designed to create real economic recovery. We must press for permanent solutions, and we must continue our steady insistence that ours is a community worth fighting for, and that rebuilding our community is the surest way to rebuild the nation. By working together, we can continue to effect bigger and bolder responses that will build a better future for our children and families and make all of our communities stronger and healthier. Thank you again for joining us today. I think you will be inspired by all our panelists and speakers, and I look forward to sharing this afternoon with you. But before we get started, I want to talk a little bit more about the platform that we are using today for this virtual conference. The platform is intended to create an interactive experience and social opportunities for all of you to meet speakers and connect with other attendees from across the country. We encourage you to visit the main agenda page on the platform to view the list of activities scheduled for this afternoon, which is packed with panel discussions and virtual mixers. During the panel sessions, you will be able to chat, but also grab the mic and join panelists on stage to ask questions. There are also a virtual mixer where you will have the opportunity to network and connect one-on-one with other attendees from across the country. The platform will introduce you to and match you with someone new every 5 minutes. So be sure to be camera ready. I know we have been socially isolated for quite some time, but here is your opportunity to safely network, just as you will do during an in-person conference, minus food and drinks. Okay, so you can also participate in the discussion by sharing on Twitter using the handle Hispanic Fed and hashtag HF COVID Summit. Again, that's at Hispanic Fed and hashtag HF COVID Summit. Now, let's get started. I'd like to hand it off to Ingrid Alvarez Di Marzo and Diana Cava from the Hispanic Federation team, who will share more on Hispanic Federation and New America's latest report, Overcoming COVID-19 Economic Barriers for Latino Communities.
Thank you, Frankie. Good afternoon and welcome to Overcoming COVID-19 Economic Barriers for Latino Communities. I am Ingrid Alvarez and I am the Vice President of Public Policy and Strategic Engagement at the Hispanic Federation. Thank you to everyone who joined us today. Deep-rooted inequities have shaped inequitable experience of the social determinants of economic security and health that today demand our response to the dual pandemics of COVID-19 and systemic racism. Latino and families of color experience greater financial insecurity as a result of historical and contemporary inequities that have been institutional and societal structures, policies, and norms in our country. HF's economic empowerment advocacy and coalition work is centered on our commitment to ensuring the financial health and well-being of our communities. During this presentation, Hispanic Federation will present its white paper, Overcoming COVID-19, Economic Barriers for Latino Community, using the collective wisdom of Latino civic leaders, business owners, nonprofits, and individuals. We will lay out a series of specific policies that can help our communities recover. These are timely proposals that emerge from the people and institutions that know our communities the best in direct response to the American Rescue Plan. The American Rescue Plan is a step in the right direction for alleviating the burdensome challenges experienced by the tens of thousands of Americans. It is the first step. Equitable recovery requires collaborative efforts as a constructive response to creating healthy communities and expanding the safety net for our children and families. Our plurality, members of our community, nonprofit organizations, our philanthropic and funding partners, together is the support needed to systemically solve existing and emerging challenges that cannot be solved by government alone. Implementing these policies will require a commitment by our political leaders and our own steady insistence, as Frankie said, that our communities, that ours is worth fighting for, that rebuilding our community is the surest way to rebuild the nation. At this juncture, I'd like to thank our partner, the New America Foundation and its New Practice Lab, for their partnership and opportunity to provide you with this report today. The New America is dedicated to renewing the promise of America by continuing the quest to realize our nation's highest ideals, honestly confronting the challenges caused by rapid technological and social change, and seizing the opportunities that those changes create. The New Practice Lab works at the intersection of ideas and underground experimentation to improve the design and delivery of policies focused on family economic security and well-being. I will now pass the program to my colleague, Diana Cava, Assistant Vice President for Public Policy at the Federation. Take it away, Diana.
Thank you so much, Ingrid. And I believe the presentation will be coming up shortly, but let me begin. As has been mentioned already, as Latinos and other groups collectively battle the coronavirus, the Hispanic Federation and New America aim to identify gaps in data and information to help the community with this existential change. Communities and the nonprofits, philanthropists, and local governments that serve them urgently need assistance to access and interpret data for decision-making. They also need help in informing the public about the patterns of COVID-19 infection and the community responses needed to fill these gaps and ensure informed decision-making in response and recovery. So in response to that, Hispanic Federation and New America's report, Overcoming COVID-19 Economic Barriers for Latino Communities, aims to accomplish 4 broad goals. Use data to strengthen the evidence base for how conditions impact the livelihood and well-being of Latinos. Ensure that community participatory research produces data that can be communicated in ways that change how audiences perceive the Latino community and how their issues are addressed. Build the capacity of local people to use data to promote community leadership and make informed decisions about issues that impact them, and develop norms for how data should be created and used to ensure equity and inclusion. The report combines information and statistics from respected national, state, and local sources with key findings from a 3-part data collection effort. At the end of 2020, the Hispanic Federation, in consultation with New America, launched its community-driven research to better understand how the COVID-19 pandemic has impacted Latino communities in Connecticut, Florida, Illinois, New Jersey, New York, and Puerto Rico. Through community surveys and focus groups, we learned about how the pandemic has impacted Latinos and their ability to work and or access assistance for their basic needs like food and shelter. And while we did focus on specific geographies, we realized that there was a lot of similarities across the board. The findings that have been collected and presented in the report, Overcoming COVID-19 Economic Barriers in Latino Communities, is intended to help decision makers better develop programs and policies that serve the needs of Latino communities. Briefly, small business surveys. In early October 2020, HF, along with New America, we conducted a community survey to capture the experience of Latinos across several states to understand the economic impacts of the pandemic. The 12-minute survey disseminated in the 6 targeted states and regions was completed by 2,906 community members, including 1,936 who responded in Spanish and 970 in English. In addition to distributing the survey amongst our network of advocates, member agencies, and partners, we also promoted it through targeted social media ads, and were able to have participants participate in a drawing for a $250 gift card. In late October, to identify where and how businesses have been most affected by the crisis, particularly in areas where people with low incomes and communities of color live and work, we also disseminated a 7-minute survey to over 1,000 small businesses in the targeted geographic areas. We received responses from 93 small businesses, 97 of them Latino-owned, and gained insights on businesses' evolving needs during the pandemic. In November 2020, we conducted 7 focus groups with nearly 90 Latino nonprofit professionals and community advocates serving communities in New York City, throughout New York State, New Jersey, Connecticut, Florida, Illinois, and Puerto Rico. Top-line community survey findings and state-specific results were shown in each focus group. And after that, we led 3 rounds of breakout brainstorming sessions to help participants identify best programmatic practices regarding food and shelter supports, income and small parts, and recommendations for systemic changes and policy solutions. Using insights gleaned from the focus group participants, HF composed recovery strategies that will enable organizations, philanthropists, and policymakers to develop, expand, and fund programs that serve the needs of Latino communities with a focus on work, food, and shelter. As you should see on your screen, some of the top findings, particularly when it comes to demographics, we found that 85% of the Spanish language survey takers identify as women. Overall, 79 of all survey takers identify as women. Nearly 70% of all survey takers identified as head of household, and nearly 3/4 of Spanish language survey takers reported making less than $45,000. And overall, nearly 60% of all survey takers reported making less than this amount. And top-line findings, with regards to employment, 75% had identified as employed, self-employed, or business owner prior to the pandemic. Nearly 80% of the Spanish language survey takers reported a reduced income. Overall, all respondents reported losing income, and 50% lost their jobs. Over 1/4 of participants identified as an essential worker. 87% of Spanish language survey takers reported using savings to cover basic costs like food and shelter, and 65% of language survey takers as well. Overall, 76% of all survey takers reported using their savings to cover these costs. And nearly 1/3 of respondents have not been able to pay their mortgage or their rent. A total of 43% amongst Spanish language versus 20% of the English language survey takers. So very briefly, to go over the main recommendations that came about for work. I'll go through this very briefly since I know that we're running short on time. To address the pandemic's disproportionate economic impact on Latino workers and provide equitable assistance to those hardest hit by the pandemic, federal, state, and local government must expand and better target relief assistance. This means prioritizing lower income communities, expanding cash assistance through community-based organizations that can reach Latinos most in need, and monitoring the expanded payroll protection program to ensure funding gets to smaller and minority-owned businesses. Worker rights and protections should be enhanced to guarantee safety protocols for all workers, especially agricultural workers, inform workers about their rights, ensure worker benefits for employees who fall ill with COVID-19, and provide equitable pay, especially for essential workers. To provide Latino workers and small businesses access to available assistance and services, government agencies should offer bilingual information about programs, application assistance, and culturally competent services. A wide range of and training efforts are needed, from immediate community hiring measures to longer-term job creation and training investments, universal access to childcare, and financial education and services for individuals and families. Regarding food, the recommendations to increase food security for Latino households, the U.S. must systematically address both immediate needs and historical inequities that have caused Latinos to suffer from hunger at disproportionately high rates. Local, state, and federal government should expand, improve, and better target food-related assistance. This includes expanding free breakfast, increasing food delivery, ensuring that the food provided is nutritious, and also expanding access to SNAP and NAP. And once and for all, as the Biden administration is working to do the public charge policy that has forced so many struggling immigrants' families to forego assistance available to them. Community organizations providing hunger relief services should also receive increased support and become part of a food access pipeline between local growers and hard-hit communities. And with regards to shelter, there's a great need to expand and extend protections against evictions and foreclosure, while also protecting landlords who are providing affordable housing. Long-term solutions are also necessary, including policies that ensure safe housing for agricultural workers, expanded shelter options, and ensure safe conditions within shelters, increase affordable housing stock, and provide education and resources to increase home ownership. Ingrid, can you share some of the cross-cutting recommendations that came about from the focus groups?
Absolutely, thank you, Diana. The chapters on work, food, and shelter include program and policy recommendations specific to those aspects of life. However, some of the challenges facing Latinos and other communities of color and immigrant groups have broader cross-cutting causes. They involve systems and policies that limit Latino access and opportunities in multiple facets of life, and include issues such as limited access to the internet and other technology, treatment of immigrants, especially those from mixed status families, and failure to engage trusted entities. Pardon, I just lost my space. Trusted entities as partners in providing information and services. Focus group participants from all regions provided guidance for the following national recommendations. Greatly increase the involvement of Latino-led community-based organizations as providers of emergency assistance and outreach and ongoing education and services. End inequities and exclusion of mixed status families and undocumented people from relief, services, and ongoing programs. Make relief assistance available to the re-entry population. Recognize and address transportation issues that limit access to certain opportunities. Bridge the digital divide. Provide robust, linguistic, appropriate communications and assistance to the Latino community during the pandemic, and make culturally and linguistically appropriate physical and mental health services more available and affordable. Diana?
Thank you, Ingrid. I had muted myself. So yes, this project started the end of last year, and while, as was mentioned earlier, there has been a lot of progress, even with some of the recommendations that I spoke on. There has been progress, but the work continues. We know that this document itself is a working document, something for folks to be able to use when it comes to their advocacy and their policy. But we want to continue engaging. We want to continue engaging our member agencies, our partners, community folks, to be able to share their voices and to make sure that the community, that the Latino community is in the conversations, especially when it comes to the equitable recovery for all as a result of the pandemic. And I want to take the opportunity right now to introduce from New America, Cassandra Robertson, who will be speaking about an opportunity for us to continue this conversation and make sure that our community voices are heard. Thank you for joining us, Cassandra.
Thank you so much for having me. First, I just want to say that this research is so powerful and important, and I want to thank all of you for your work, for this fantastic event, and for this wonderful presentation. We're really honored to be your partners in this. As you mentioned, I have a very quick ask. Our team at New America is doing research to better understand the experience that low-income individuals have accessing stimulus payments. In January, the Biden administration announced that 8 million people who are eligible had not received their payments. So our team is trying to understand who these people are so that we can make sure that they receive the benefits to which they are entitled. We are hoping to talk to individuals who do not regularly file income taxes, and we will be compensating them for their time. So if anyone has any contacts that you think would be helpful, that could help us serve your community better, please feel free to connect us. I think a link will be sent around. And again, thank you so much for including us in this event and for your really essential work and your partnership. And I look forward to it continuing. Thank you.
Absolutely. Thank you so much, Sandra, and to everyone at New America and the New Practice Lab for the tremendous support and for the opportunity to continue this conversation. So again, it's critically important to have more folks from our Latino community involved in this work. And after the summit, we will send more details about this opportunity as well as the report to assist everyone here with their advocacy. So immediately following this talk, oh, apologies. I think if we wanted to have an opportunity for folks, if there were any questions, anyone else wanted to grab the mic like Cassandra just did. If not, don't worry, because the conversation, the party continues. Immediately following this talk, please join us for our first discussion, kicking off now at 1:30 p.m. or 1:33 p.m., which will focus on the American Rescue Plan and a path of healing and recovery for Latino families. We'll hear from community leaders on how the American Rescue Plan legislation directly impacts the Latino community, as well as prefatory remarks offered by our Senate Majority Leader, the Honorable Charles Schumer. Thanks, and we'll see you in the next session.
Gracias.
began spreading across our country. And one of the most terrible realities about this crisis is that our communities of color, especially Hispanic Americans, who have suffered most. We have a lot of work to do to heal the wounds that this crisis has inflicted on Hispanic Americans. They face higher rates of infection, unemployment, small businesses failing at a higher rate, and the community has struggled more than other communities to access the assistance so needed. But there is good news. Earlier this month, I was proud to lead the American Rescue Plan through the Senate, and now that President Biden has signed it into law, help is on the way. The Rescue Plan is a $1.9 investment in the American people in this time of crisis. Will provide unprecedented help to those who need it most, including our immigrant communities and families in Puerto Rico, until our country and economy come roaring back. Here's what it'll do. It'll increase the stimulus checks from $600 in December to $2,000 now for each person in each household. A family of 4 will see a new check of $5,600. And I'm proud families with mixed immigrant status. This was essential. I worked hard to get it done. We're also supercharging our vaccine distribution to get shots into as many arms as possible, including by reaching out to communities of color to get to the front of the line, not the back. We're also providing $120 billion for K-12 education, money for schools to update ventilation, support teachers, get school supplies and funding for after-school programs so kids can catch up in their studies. And I'm especially proud that we expanded the child tax credit. Most parents will now get $3,000 per year per child ages 6 to 7 and $3,600 per child under the age of 6. The checks should start coming every month, $300 a month, starting in the early summer. And something else, we have also secured the largest, most complete package of aid for Puerto Rico in a very long time, expanding Puerto Rico's earned income tax credit to $3 for every dollar the Puerto Rican government provides. And we've invested hundreds of millions in emergency health, rural transit, rental mortgage, and made Puerto Rican families eligible for stimulus and child tax credit. That funding's been a long time coming. In the past, because of bigotry, Puerto Rican families had to have 3 children to get the credit. Now they're treated like they're everyone else of their fellow American citizens. So in conclusion, in other words, help is finally on the way for the American, and I promise it will not return to life the way it was before, but take the painful lessons of this crisis to build a better world where all people have a chance at prosperity, where no one has to face bankruptcy or poverty if they worked hard their whole lives, and where we honor our country's diversity and celebrate what makes us so unique. So thank you, Hispanic Federation. Thank you, Frankie, for all your incredible work, and my very best to all of you.
Thank you to Leader Schumer for his kind of word. I love when he said amigo. When I love that. So since we are now family, somos amigos todos, I want to have this conversation like we are in our living room, having a cafecito, right? So please feel free to jump in, and we're going to have like a quick round of questions, and we will pause to at 2:05 to move on to the next discussion. So again, you know, the American Rescue Plan is a landmark accomplishment that will improve the lives of millions of Americans as the nation begins the slow and painful process of regaining its footing after a full year of COVID-19 pandemic. The enactment of the American Rescue Plan gave the economy a jump start and strengthened the safety net for the most vulnerable Americans. But Cindy, Marcos, Dr. Flores, you know, from the perspective of like the work that you do, what do you think are some of the provisions in this plan that will be most helpful to Latino communities and immigrant communities, or that you are most excited about? What about, let's start with Cindy.
Muchísimas gracias, Frankie, and it's a pleasure to be joined by you, Marcos, and Dr. Judith Flores during this discussion. And just a shout out to all the CBOs, all the individuals who are on the front line working with our communities. Know that so many in our community are suffering. I just got back from Gainesville, Georgia yesterday. We were on the front line fighting and working for our poultry plant workers. 6 of them who passed away on January 28th doing a nitrogen leak at one of the poultry plants there, and still no justice has been done. And so, you know, that's the reason for my existence, and I really do love the work that I do. But as I think of the American Rescue Plan, I will tell you that one of the areas that I'm most excited about is the expansion of social safety net programs, which impact so many of us, but among those, broadband. And you know why broadband for us is so important, Frankie, is because 1 in 3 Latinos do not have access to technology or broadband. And then you think about the number of Latinos who are not computer literate. There has been no adoption within the household, and you're talking about 40 to 50% of Latinos. Why this is so important is because even as you look at the rollout of COVID-19 vaccination, oftentimes the way that you sign up is through online, through a computer. The form is accessible only online. And so if you're looking at how do we address COVID-19, how do we make sure that our communities are safe and sound, technology is a part of the equation. And specifically when we're looking at broadband, two areas to point out is the Emergency Connectivity Fund, and that's to reimburse schools and libraries for providing free broadband access and connected devices to our children and families. And again, we already know, Frankie, that our children are failing in school, and there's so many layers to peel back just on that. The fact that so many parents have to go outside of the household to work, the fact that so many older siblings are now taking care of the younger siblings, you know, the fact that online learning can be really hard, especially if English is your second language. And, you know, you add the layers, and we know we have Dr. Miguel Cardona has his work cut out for him in the months and years to come. And then you also look at the fact that with this bill, there was an infusion into the FCC's E-rate program, allowing for homeowners to get assistance with internet access services. You know, really broadly, I would say the other parts that are really, I think, really interesting, and I'm going to stop after that, is the money going into education. The fact that $130 billion will be going to safely reopen our K through 12 schools, either for PPE, to hire support staff, make sure that our students, that our teachers, the administrators are staying safe, and that 20% of that money must be directed to programs to help counteract learning loss for students who have missed school. And again, oftentimes we already know that many of those students are children of color, includes our Latino community. And then when you look at the $40 billion that's going to colleges and universities, half of that money must go to emergency grants for students. And so as I think broadly, Frankie, of the provisions of this bill, I also want to point out that 2.2 million citizen kids who were previously excluded from cash payments are now included. And also when you look at other wins, the bill includes the elimination of immigration status penalty on earned income tax credit, as well as state and local funds included in the bill. It has no status restrictions, so states can actually use those funds to assist undocumented families. And lastly, I would say that I was glad and happy to see dedicated funding going to our territories, which includes Puerto Rico. And it's everything from state and local recovery funds to also the Coronavirus Capital Projects Fund. So I'm going to stop there. I know there's so much more to talk about, but I want to make sure that Marcos and Dr. G. De Flores also get to say something.
Thank you, Cindy. And it's so important that you bring up the technology issue first, because now our lives have been transformed by technology. They have forced us to think and work in a different way and get education a different way. And in many cases, we cannot go back. We cannot go back. And it is so important to address that. Dr. Flores, I want to go to you because, you know, some people think that this pandemic is over by just getting the shot in the arm. But this historic plan, this historic bill, also addresses some of the health disparities that put us in the place that we are right now. Talk to me a little bit and to everybody about what do you think, or what excites you more about this plan? You're on mute.
Buenos dias.
Buenos dias.
I happen to be a physician that's worked in primary care and addressing health disparities in the New York City area all my life. I'm also a pediatrician. So this plan excites me tremendously because of the communities that I serve and have worked with. So there's a couple of things. I support the broadband issue that was just described, because a lot of the education we're doing around vaccine enhancement, vaccine engagement is done virtually. The way I reach community members now is through my computer, through a virtual medium. So if they do not have appropriate access, which in many cases they don't, and in their language, linguistically capable, not only in Spanish, by the way, but in Spanish and translated to indigenous people that we have sufficient, of which we have sufficient number in New York. I do lectures with them every week where I use a translator. All of that has to be supported in some way. It's supported now, but it will not be supported. These are very marginalized communities. So I'm very excited about that. As far as the COVID pandemic and the vaccine, there is no doubt that we have to make sure that we ensure that the Hispanic community, the Latinos and Latinx community, have appropriate access and engagement where they are in their language and in a way that they can appreciate. We have people dying and being ill today. I work very closely with communities in Queens where we have high levels of cases and still have people very effective that know nothing about the vaccine or are very afraid. The only way we're going to address that basically is to give them a proper medical home. That's also in the plan. You cannot, what we're doing now is trying to make up for the fact that many people don't have their own doctor, don't have a medical team, don't have someone that they can speak to. So what they have to do now is we really have put a Band-Aid in. So people like me go on virtual camera to talk to a community and they don't know me. But yet people that are my patients know me, and I do not have a problem being able to communicate with them directly. So we have to use this bill not only to go back to what we had in community clinics and federally qualified clinics and those types of services, but to improve and make sure that it's done the right way, using every modality that we need. By the way, one of them is telehealth, and we really need to make sure that that's accessible to our communities. So I'm very excited. But the message again is this is not over. We need a lot of work done. And I think ultimately, if we recognize what the pandemic has laid bare, is that we have a very inequitable, poorly accessed health system, even with the Accountable Care Act. So we need to move forward. This, I think, is the next step to building that home for us, the medical home we all need. So thank you very much.
Absolutely. I totally have to agree with you in the fact that if we try to do a recovery that puts us in the same place that we were before the pandemic, we are going to be at a disadvantage anyway. So we need to aspire to have a recovery that is equitable and that is fair to our communities of color, but also our community. Marcos, you live in the world of Florida, Central Florida. That is almost just like, you know, the yin and yang. When I live in New York, you live in Florida. What do you think is going to have the biggest impact of this particular bill in the reality of your community that you serve in Central Florida and Florida as a whole?
Well, Frankie, thank you for having me on the panel, first of all. And I want to reiterate the points that Dr. Flores and Cindy mentioned about broadband. Clearly, I think from the very beginning of the pandemic, this came as a really obvious barrier for access of information and access of services for our Latino community. Florida, as you know, is a tourism industry. And a lot of service jobs. Our community, our Latino community, our Puerto Rican community works in Disney, in the parks, and the hotels. And these were industries that were hit hard by the closure, that happened after COVID, and has continued suffering hardship throughout the pandemic. With regards to I wanna say a personal story. My mom and dad, they are college graduates, but they're in their 80s. They're very successful, hardworking, intelligent people, but they have challenges even working with their smartphone. And if we look at the majority of our community, and especially the elderly, particularly here in Florida, we depend on the younger generations to be able to access the information and access the service through broadband for our parents, for our grandparents. And in a situation where our younger generations are struggling, the impacts of having lost a job, not being able to pay rent, this becomes a real serious problem. It's no surprise that the statistics as it relates to COVID impact, COVID transmission, and even the services that were being provided by government, the Latinos were the last ones in terms of the statistics, in terms of being able to access services. So to me, the parts that everybody's announced about this ARP bill, America Rescue Plan, that are really exciting are those parts that everybody knows already, right? The additional $1,400, right, for every worker, that every adult that has gone through this and is currently having a low income and a trouble economically. So the financial impact of those checks, the additional $1,600 per child. I mean, we're talking about working families that are right now really having a hard time making ends meet, and that is a huge impact, obviously, and I think a great exciting part of this bill. And also the fact that premiums for the healthcare marketplace are going to go down and are going to be $1,400 lower than they were currently. These are things that are going to impact thousands and thousands of families in Florida and in Puerto Rico. And as a Puerto Rican, I'm also excited to see all of the great things that have been, the first time that Puerto Rico in many of these categories is being treated with some level of equality. And that is also very exciting to me as a Puerto Rican. So I wanted to say that in terms of, in the context of what I think are the most exciting things about this plan. But Cindy hit it on the nail with the broadband. It is a crippling effect. Our lack of access is a crippling effect in our community right now. And it's so glad that such a contrast, right, from the previous efforts from the previous administration, that this administration is thinking about the details that truly impact and affect the lives of common people, of ordinary people, working families.
And that is a very important point, Marcos, because the toxic narrative around our communities during the last 4 years are not going to be erased by a couple of months of a new administration. This is going to link is important to invest in our community resources and this community that is here. This bill is huge, it's historic. There's so much that people need to know about and that we're excited. But one bill is not going to fix everything. So in your opinion, I'm going to go around, I'm going to ask you in the last few minutes that we have, what do you think should be what we need to target for the next bill that is going to allow us to continue this process of recovery? Let's start with Cindy.
Thank you for that question, Frankie. And what I would say is that sometimes not knowing is the issue, right? Like, so many in our community do not know some of the provisions that are in this bill, like the housing assistance programs, which, by the way, when you look at like them going to the States, it does not have an immigration status restriction. And so making sure that our mixed status families are undocumented, our most vulnerable, are aware of these resources, I think will be important. I would say, Frankie, I think it's so important as we look at, future bills, when we're expanding unemployment benefits, making sure that when we look at paid sick leave for employers, that it's not something that's optional, but that actually it's mandatory, right? Like in this bill, the employer gets to choose. And for so many in our community, many of them do not have access to paid sick leave. Many of them do not have access to maternity leave, and are not even able to take a day off to go and get checked out to see if they have COVID-19 or even to get the vaccine. And so I think, moving forward, I think that will be very important. I would say continuing to invest in our broadband, Frankie. This is, this bill, again, is not a one solution fix all. And so I think as we look towards the future, I know there was a lot of focus on schools and libraries, but how can we help the individuals, the parents and the children, making sure that we continue to expand the adaptability portion of this, right? Like, so it's not enough to just provide access if our families do not know how to use the technology, right? If our parents are having problems logging in their children into their school, right, for online learning, or if the grandparents, which I have seen so many multiple cases, including in my own household, are not able to help in terms of helping the children being able to log in to be able to take those classes. And then I would say, I know that this bill includes grants for businesses, specifically for restaurants and bars, as well as additional PPP loan funding. But I would say, Frankie, just given the disproportionate impact on our Latino community, making sure that we are including even more grants and funding for small businesses, minority-owned businesses. And then one point on that is that the federal government does not track based on ethnicity. And so we are pushing so that funding is tracked based on ethnicity. We want to know exactly how much money is going to the Latino community, because if we don't track those numbers, then we don't know if we're failing our community, if our community is even accessing these programs. And we already know from the previous PPP loans that our community was not able to tap into these programs because they did not have the infrastructure in place. And so as I think of the future, Frankie, I would say continuing to invest in broadband, investing in our businesses, and then I would say making sure we continue to invest in rental assistance and mortgage assistance. We are just beginning to uncover how much housing insecurity exists. I know this bill has some provisions in financial assistance, but I do think as we move forward, that will be a major issue that we're going to have to confront as so many of our communities continue to be unemployed.
I totally agree. Broadband means now work. Broadband means education. Broadband means health. It means so much. Dr. Flores.
Yes.
What would you say in a minute or two? What would you say is what you would like to see on the next bill?
Top thing, I want to see a $15 wage. This is not sustainable. This is patchwork. It's wonderful, but you have to give people enough to get through on their own. So that's very important. Helps everybody. The second thing is, especially in New York, we're doing something around children and the child tax credit. There are children that are going to be marginalized through this child tax credit. Almost 72,000 children in New York are not going to be eligible because they don't have a social security number. So a lot of it is partnering with other agencies, American Academy and HMA. Some of us are really getting around this issue to make sure that these children get what they need and these families get what they need. And of course, healthcare, the way to get to healthcare is using all the medium, including the broadband.
Absolutely. Absolutely. And Dr. Flores, you also are talking about a lot of things that people don't know and that we need to make sure that our community knows about it. Somebody in the chat is asking, how can we help? We need to inform our community. We need to get together. We need to let them know about all of these opportunities. Otherwise, they're not going to know. Marcos, you have 2 minutes to say what is your wish list for the next bill.
Well, I think that this is a great bill. It's certainly more encompassing than anything we've seen so far. And I applaud the efforts around broadband and all of that, but it's not, this bill is not going to turn a switch and solve everything for our people either. And we have to also understand that the education and the capacity of being able to incorporate that broadband and being able to adapt to that is not going to happen overnight because we turned on a switch or we got some funding. So I'd like to see programs where nonprofits like ours can put people in the streets. I want to recognize Father Jose Rodriguez from La Iglesia Episcopal Jesús de Nazaret, who took it upon themselves to work with my organization and many other organizations, including Hispanic Federation here in Florida, to send people to the Bravo supermarkets to give out the information and sign people up for the COVID vaccines. We got in one day 500 elderly retirees to sign up to get the vaccine, which would not have been signed up if they had to do it online. So we need to put people out in the streets also. We need to make that access where people are going. They're going to the supermarket. Let's put a person in every supermarket to give that information out. And I'd like to see nonprofits open up a stream of funding so that we can put people with the right information. There's a lot of disinformation out there as well. So we need to have real good information and connect that access to the services directly with the people. And so, that's something that I think would be very useful and very helpful immediately.
Sometimes people forget that nonprofit organizations are employers in communities. They are economic agents of community in communities where other people just think, it's not convenient for them. So it is not only about the economic agent, but also all the power that outreach and community-based organizations can do. I'd like to conclude that I always compare what happened to us with COVID with what happened in Puerto Rico with Hurricane Maria. When the Hurricane Maria passed through the island and pulled all the green, the luscious green around the island, suddenly people saw poverty for the first time. And they said, where's this extreme poverty coming from? It was always there, it was covered. And this is what COVID-19 had done for us. It had pulled this curtain and have forced us to look at these disparities that already existed. And we have an opportunity to rebuild and recover better. So thank you so much to my panelists. It's always a pleasure to talk to you. And now I'm going to invite everybody to move to the next session, which will focus on fighting poverty and building resiliency within the Latino community. Muchas gracias a mis panelistas. Thank you everybody for watching, and I'll see you in the next room.
Gracias.
President and CEO of Hispanic Children and Families of New York City, Karina Ayala Bermejo, the CEO and President of the Instituto del Progreso Latino in Chicago, and Brian Rosa Rodriguez, the Public Policy Manager for Youth Development Institute of Puerto Rico. Welcome so much, and thank you for joining our panel today. But before we start this conversation, we'd like to share some brief prefatory remarks offered by the chair of the Congressional Hispanic Caucus, U.S. Representative Dr. Raul Ruiz.
Thank you, Brett. Good evening, everyone. My name is Congressman Raul Ruiz, and I represent the Coachella Valley area in Southern California. I am an emergency medicine physician and a public health expert with training in humanitarian and disaster aid. I'm also chair of the Congressional Hispanic Caucus. It is a true pleasure to be with you at today's summit to discuss the Hispanic Federation's findings on how the Latino community can achieve a just and equitable recovery following the economic fallout of the COVID-19 pandemic. As the son of farm workers, I understand firsthand the challenges many in the Hispanic community face. I grew up in a trailer park in a farm worker community with parents who worked with calloused hands and tired backs sun up to sundown to provide me and the rest of their children with opportunities they never had. Because of their hard work and dedication, as well as the support of my community, I was able to attend UCLA, earn a master's degree from Harvard in public health and public policy, and graduate from Harvard Medical School with a medical degree. Hispanics play a central role in the U.S. economy, especially as essential workers and workers in industries hardest hit by the pandemic. Working in frontline occupations such as healthcare, agriculture, grocery stores, and transportation has increased the risk of exposure for many in our country, including the Hispanic community. Immigrants are more likely to be low income and work low-wage jobs that do not offer paid sick leave or employer-sponsored health insurance. And because of the persistent discrimination and inequities in the labor market, Hispanics face one of the highest unemployment rates in the country, with Latinas disproportionately affected. In December, 9% of 2.7 million people were unemployed. People of color are also more likely to live in overcrowded housing, such as multi-generational families or low-income that make it difficult to social distance or self-isolate. And communities of colors are at an increased risk for serious illness if they contract COVID-19 due to higher rates of underlying health conditions such as diabetes, asthma, hypertension, and obesity. Together, these circumstances help disproportionately high rates of COVID-19 and economic hardships from the nation's Hispanic population. As chair of the Congressional Hispanic Caucus, I can assure you that all 38 members of the caucus have worked tirelessly in administration and congressional leadership to ensure that the emergency aid programs in the American Rescue Plan support Hispanic families. Among the many worthy provisions, the CHC worked to ensure the inclusion of stimulus payments for millions of mixed-status families and U.S. citizen children living in mixed-status families who were excluded from previous COVID-19 relief packages. The administration has also heeded our calls to make the vaccine available for all high-risk individuals without regard to immigration status. The Congressional Hispanic Caucus worked to provide relief for Hispanic families in the American Rescue Plan by delivering immediate assistance to working families bearing the brunt of this crisis. The bill includes the expansion of the Earned Income Tax Credit and $88 billion to expand the Child Tax Credit from $2,000 per child to $3,000 per child 18 and $3,600 for a child age 5 and under. Taken together, the expansion of both the Earned Income Tax Credit and the Child Tax Credit will help lift millions of low-income children out of poverty, including 4.1 million Hispanic children. The American Rescue Plan will help put our nation on a more inclusive and speedier path to recovery for everyone. The CHC is committed to continuing to lift the barriers and systemic inequalities Hispanic families face and deliver progress for Hispanic communities. And we look forward to continuing to work with our colleagues in Congress as well as President Biden and Vice President 100 days and beyond. Thank you very much for having me today, and thank you to the Hispanic Federation for strengthening and empowering Hispanic communities in education, health, civic engagement, economic development, the environment, and much more. Together, we can advance public policy that creates lasting changes to ensure the promise of America accessible to the 60 million Hispanics living across our country. Thank you, and good.
Thank you so much, Chairman Ruiz. We're so delighted to have you leading the way for our community in the Congressional Hispanic Caucus and in the Congress. And we know that your efforts have been a big part of why the current bill has been such a big benefit to Latino communities across the country. So I want to follow Frankie's lead and suggest to everyone that let's just pretend we're in a living room sitting together and talking amongst each other. And I would like each of our panelists to introduce themselves briefly, but also to start by answering one of the key questions I think facing us during this whole summit today, which is how have your organizations been able to respond to COVID-19 and serving our community? We know that your Latino organizations are the trusted voices in our community, that you're the folks that our community goes to first when they need help and support. And so we know that you've had a lot of demands placed upon you. So just tell us a little bit about how you've been able to respond. And then on top of that, if you could perhaps mention, if you had additional resources, what else would you be able to do? What other things would you like to be able to do to better serve our community? Ramon, you want to go ahead and start?
Thank you, Brent. Thank you so much. First, let me start by thanking the Hispanic Federation, Frankie Miranda, his president, and the entire team for putting this much-needed summit together. You know, when flying on the plane, you will hear them instruct you to first put on your oxygen mask in case of an emergency, and then assist others. Well, this pandemic didn't only affect the families we serve, it also had a huge impact on the organizations that help those families in our community. We at CHCF knew that we needed to help, but the question was, are we equipped to do so? And to that end, we did a quick evaluation of our resources, our abilities to ensure that we had what was needed by our community. We then set out to support our community with some new basics. Through our work with the state and the Office for Children and Family Services, we were able to secure hand sanitizers, masks, and other PPEs for our providers of early learning educational services in residential settings. Some call them at-home childcare providers, but I think that title minimizes the quality and the importance of their work and their profession. We also, working with the CARES, through the CARES Act, we've been able to ensure that essential worker parents receive scholarships to pay for childcare while they put their lives on the line to keep the economy going. Furthermore, money was also made available to providers to retrofit their homes in line with the CDC guidelines, allowing them to continue to educate in their home and keeping those essential services open to our community. Last I checked, we, along with our consortium partners, have been able to disperse over $7 million for these endeavors. In our after-school programs, we had to pivot to a vital model. This meant that we had to assess our students' ability to receive virtual instructions. We were able to provide hotspots to 120 of our students whose housing conditions did not allow them to have internet access that they needed to go remote. We also purchased 32 laptops and lent them out to our students to ensure that the continuity of their learning experience. These were students that were not given the tools that they needed to continue their education, nor did their families have the financial resources to provide them for them. Additionally, we provided hundreds of backpacks to our students filled with books and PPE as they began their transition back to a hybrid model of learning. Furthermore, we are happy to report that during these most difficult of times, we were able to encourage 9,000 families in our community to fill out the census. The pandemic will soon pass, God willing, but the effects of our communities being undercounted in the census will have a long and enduring negative consequence. The food insecurity that we are going through, we have been able to partner with local elected officials, and presently we give 200 meals to families weekly, a meal that serves for a four-person family. We have continued to do the advocacy and the policy work, because a lot of times in times of emergency, people forget that the issues that our families and our communities are going through sometimes are put in the back burner. So our policy and advocacy team are ensuring that the voice of those less fortunate, those that sometimes get muffled in the crowd of many, are listened to and are heard, I'm very happy about the American Relief Act and the monies that it has been put in there for our community. I am hopeful that as it trickles down, our community, our people, our families will receive their fair share. We talk about essential. Well, essential equates to how vital you are. Our community has said presente, and it is time that we are treated as the essential, not only workers, the essential Americans, the essential humans that we are in this economy. Thank you, Brett.
Thanks, Ramon, and thank you so much for the work that you're doing. And yes, we'll work closely with you to make sure that you are getting the essential support that your organization and so many others deserve. Brian, do you want to go next?
Sure. Thank you, Brent, and amazing work. Thank you for sharing all that you do. I'm the policy manager for the Youth Development Institute. We're a data research and advocacy organization. And back at the beginning of 2020, we all woke up with earthquakes on the island, and that really rattled and shifted the way that we really think through our process and our analysis. So thinking about that natural disaster, just 2 months after a worldwide pandemic launched, none of that was in our strategic plan. I bet nobody was planning on having a pandemic for 2020. So as a research and data organization, we quickly went to our strengths. We basically developed an economic estimate of the impact that the pandemic might have had on families with children in Puerto Rico. So this allowed us to really understand and pull up policy recommendations of things that policymakers could do immediately to really start pushing the needle on equity for Puerto Rican families. One of the things that we discovered is that Puerto Rico was left out of a huge nutritional package called the Pandemic EBT program. This program allowed children who went to school to receive the money equivalent to that meal that they would get for lunch and breakfast directly to their card that a family would be able to use. We didn't get access to that program up until September, and it took a lot of advocacy and a lot of coalition work. So we really put it up in our agenda, and we really pushed for that throughout 2020. And we also, it was until last month, February, that the funding was retroactively given to families with children in Puerto Rico. So the fight for equity is something that we are really always pushing for. The American Rescue Plan really starts engaging those policy items that we had in our agenda, including the child tax credit and the earned income tax credit for Puerto Rico. However, we understand that these are components of our larger plan. Child poverty rates in Puerto Rico have not changed since early 2000s. This is a problem and a crisis that although we've grown used to, it's a problem that we shouldn't have. As American citizens in Puerto Rico, we deserve the same dignity and the same respect as everyone else in the whole nation. So we're really proud that this administration has set forward a nice precedent to start and really put forward equity issues around Puerto Rico. However, we understand that that might not be enough. And I know we're going to get the chance to talk more about that later on. So I'm going to leave it at that.
Thank you, Brian. We definitely feel for the people of Puerto Rico who have been through so much, whether it's the debt crisis, Hurricane Maria, the earthquakes, and now the pandemic. You've been asked to bear more than any people should be asked to bear. And so whatever we can do to support your efforts are certainly very important to the Hispanic Federation. Karina, can I ask you to finish up for us?
Absolutely. Such a pleasure. Thank you, Brent. Thank you, Ramon. Byron, I celebrate, right? Long overdue, focused effort on Puerto Rico. You and your efforts are critically important. And Ramon, thanks for sharing. I'm the president and CEO of Instituto del Progreso Latino here in Chicago. Immediately when the pandemic hit, we knew we had to pivot in the most major way we've ever had. While crisis is not new to our community, this was something that we really needed to give a triple down on. Work with the census was already in motion, work with creating digital literacy programs was already in motion, but we had to accelerate everything. Instituto del Progreso Latino believes that every immigrant and their families can reach their full potential through education, training, and employment. So we are deeply rooted in education. And imagine the horror when we realized our 2 high schools needed to go remote. We launched a college for the very purpose of addressing health inequities so that we can offer a pathway into nursing, a pathway into becoming a nurse. And now we have to go remote. So immediately we surveyed our participants and we wanted to respond to their needs. Shared with us was that 60% had a drop in income, right? 30% lost their jobs and 30% were reporting mental health illness already. And that was at the onset of the pandemic. At the onset of the pandemic, our family's income was about $19,000, right? So just imagine taking a dip in an already burdened economic situation in our community. So we responded very similarly like you did. Around technology, we ensured that the Wi-Fi was available. We had already started at Instituto creating a hotspot in our parking lots so that our students can come in, pick it up, and get on with their education. We knew we had to put 400 computers in our students' hands, and we did that. We're working on now becoming a one-to-one loaner system. And our second chance opportunity school, our school where students who dropped out, traditional education didn't work out for them, and we have about 110. We knew that in order to incentivize our students to come back, we have to be innovative, right? So the curriculum, the student-centered curriculum in that space is phenomenal. From midnight tutoring to tutorials to really accelerate education, keep students engaged was a priority, especially for those students who traditional ed had not worked out for them. And we continue with our partnership, a really proud partnership with the Hispanic Federation to ensure that digital literacy isn't just for now, isn't just to learn how to use Zoom, but to transform, to use this opportunity as a way to transform the way we use digital learning and to really be an expert so that coming out of the pandemic, our students, our families are in a position to succeed when it comes to digital literacy. And just so you have a perspective, since July, we have trained 156 individuals on digital literacy. Now that they are solidly strong and of food in our community. We've fed over 55,000 individuals. We do daily lunches, and it's sad to see that need has not gone away. We get upwards 2,000 individuals in a line. What it does do, it allows us the opportunity to have an access point with our community, to push out other resources, to remind them that we're here beyond the pandemic, to get back into work. So because workforce development is so critical and because so many of our participants lost jobs, we were able to engage and have our employment specialists work one-on-one with individuals who rely on Instituto. And the third is the housing. To your point, it was critically important. We knew that the rental assistance and utility assistance and in general income insecurity was an area that we had to focus. We received some substantial funds from the state, and we put $800,000 back into our immediate community that we know made a big difference. And the American Relief Plan, of course, is going to also lift temporarily our families out of poverty, and we have to push that those become more long-term permanent solutions. In the area of health equity, I'd like to add that we took advantage of this opportunity to really bring on and employ 21 contract tracers, health navigators, and put our foot soldiers into the community to remind them of the importance of not just COVID, but of health. And I wanted to shout out Gustavo, I see you, our contract tracer from Instituto, for joining us. Thank you. Your work was so critically important because our zip codes in Chicago and here where Instituto is was one of the highest hit in Chicago. So our efforts in ensuring that the equitable distribution of the vaccine are now more important than ever. And we do that with Illinois Unidos, and we do that in a way that is accessible. We want to be able to put those shots, of which I had my second today, in the arms of our workers, not just because they're essential, right? Because they're human, because our opportunity to ensure that our community lives through this is now. So the urgency is greater than ever. Thank you.
Thank you, Karina. That's really impressive, the work that you're doing, and so excited to be partnering with you. The digital literacy is definitely a very important topic. In fact, we have a participant in today's summit who was asking about work opportunities and expressing some frustration about trying to find a job after having been let go at the beginning of the pandemic. And I think that's the real challenge that our organizations are going to have to address, is how do we help folks get back into the workforce, given the fact that the landscape has changed and the jobs that are being offered now are not necessarily the jobs that have disappeared. So we really have to do work to help make sure that that skilling is taking place and that folks are prepared for the new workforce opportunities that are being made available, because the economy is getting better, but there still are huge challenges ahead. So Brian, I wanted to turn back to you for a bit, because the Youth Development Institute's been doing an awful lot of work on the child tax credit and the earned income tax credit and in Puerto Rico. And of course, the American Relief Plan has extended those benefits to Puerto Rico in a way that hasn't happened before. So I guess the first question is, how important is this extension to the constituents that you serve? But more importantly, how are we going to make that permanent extension? Because as I understand it, once the funding for the American Rescue Plan runs out, then we're kind of going back to status quo prior to the plan being put in place. So can you help elaborate that for us?
Definitely. And I think, I cannot state how big this is for families in Puerto Rico. Just to give you a little bit of context and why we fought so hard for the child tax credit extension for Puerto Rico. Puerto Rican families who had 3 or more children were the only ones who had access to this credit because of a loophole in the law. And just to give you a number, families with 3 or more children in Puerto Rico are just 11% of all families with children in Puerto Rico. So only 11% of those families were getting access to the child tax credit. Just bear in mind that if you come to Puerto Rico, almost 6 out of 10 children that you would see are living in poverty. So just to give you the context of how huge this is for all the families who are working families in Puerto Rico, who really want to just get ahead. And these credits are going to allow them, they reward work, and they also are going to make work pay. The more you work, the more you will be benefited by these tax credits. So this is huge for us in Puerto Rico. And we included it in our advocacy plan even before the pandemic. We've been working very hard on this since the early 2000s, because we understand that these credits provide money for families to do, what's best for them. So these are money that people are going to use to either, pay rent, to pay for their nutrition needs, pay for their education needs, and really kind of put them on a better footing so they can start building up their economic mobility. So the reason why we also think that this is so great is because, for example, the EITC, Puerto Rico will be getting $3 for every dollar that we invest on our local earned income tax credit. So this is huge. We can design it in a way that it can include more families. It can be expanded. The amount of the credit provided to families can be bigger. And we can also start providing them with the EITC at lower thresholds, which can include and expand for all the families. So we estimate roughly that over 400,000 children will benefit immediately from these credits, and definitely from the expansion, everyone will be able to have access to them. The problem is that they're not permanent. So we need to fight for them so that they could be permanent for all families in Puerto Rico. And for all of you who are advocates out there and really want to start thinking about how can we organize around this, we see at least 2 opportunities to do so. Soon, there will be discussions around the budget. So the budget season opens and we need to start putting together advocacy days on the Hill and lobbying sessions with our champions in Congress so we can guarantee that Puerto Rico gets permanent access to these funds. Also, this is probably just one of the many bills that the Biden administration are trying to push through. So the next infrastructure bill could be another vehicle for us to really start thinking about how can we construct a more permanent issuance of these benefits to families in need. So really what we're all asking is to provide the needed help for families to not only continue to do the work that they do, but also have a fighting chance at economic mobility and at the American dream that we all deserve.
Thank you, Brian. That's really impressive work that you're doing. Thank you for championing these causes in Puerto Rico. And I know that many of the leaders that are part of the summit today would be very interested in helping you to try to make sure that we can extend those credits for the people of Puerto Rico. Certainly with a poverty rate like that, it's absolutely necessary and the people deserve it. So we look forward to working to try to make that a reality for you. Karina, I'm going to turn to you next. So the Instituto del Progreso has been providing youth development, adult education, career pathways, and immigrant legal aid, in addition to all the COVID relief services that you mentioned earlier, to the Latino community in the Chicago area. How important is it to you, the inclusion of immigrant and mixed status families in these relief bills for the work that you're doing? And has their exclusion from some of the government programs impacted your ability to help these families be able to become resilient and become whole after COVID-19?
Thank you, Brent. That is the real question, right? Let's be honest. For the last 4 years, our immigrant community has been in a quite difficult situation with the rhetoric that's been really causing a lot of fear and confusion within our community. So first and foremost, we are relieved that the inclusion of mixed family statuses are part of this Recovery Act, but it's also so critically important to recognize that we were already behind, right? That these are temporary relief measures that will lift our families temporarily out of poverty for those that take advantage. So there's a critical educational component to what we need to push out, right? We're in the right direction. The ability to communicate this to our communities and stay safe, let's be honest, there's a trust issue, and trusted community anchors like Instituto, like those that are around the table, need to be even more so vigilant to ensure that they don't miss an opportunity. There's skepticism, right? It's too good to believe, but at the same time, it's too little, right? And sometimes too late. We've had so much despair, so much loss, that it's going to take a little bit more than this small assistance to help our families. I think the opportunity here is that the window of the Recovery Act will allow some true engagement, with our community in clarifying the reality and in delivering information that is so critically important, and to be able to wrap around all of the services that a family needs to survive. An individual reports to work not just as an employee, but as a human being. We have to remove the obstacles of transportation and childcare. We have to double down on the equity lens that impacts, in particular, Latina workers. And we have to move towards a immigration reform that is inclusive, a solution to ensure that the pathway to citizenship is real, right? We at Instituto are proud to be the largest submitter of citizenship applications in the state, but we still got to do much more for our mixed status family incomes. Step in the right direction, need to make it more permanent. Let's double down our efforts.
Absolutely. There's a lot of work to do still to help these families. And thank you, Karina, that's amazing. I didn't know that you were the largest entity providing citizenship services. So that's pretty incredible in Chicago. So Ramon, I just wanted to turn to you. The Committee for Hispanic Children and Families has been focusing on advocacy and programs in early care, education, and youth development in the New York area. How has the closure and gradual reopening of schools in New York City impacted your work and the students you serve? And what do you feel is needed to help Latino students in the city catch up after being out of school for almost the entire past year? So many of them are struggling to kind of catch up to where they should be. And we know that this is going to be a big challenge going forward.
Brent, thank you for the question. And before I continue, Karina, you juggled my brain a little bit. And I also want to thank the Hispanic Federation. With your support and with our efforts, we were able to feed 4,000 individuals during the holiday season, something that would not have been possible without the Hispanic Federation's work. One of the biggest issues, and we have all talked about the same thing, which is really about education in different formats, but education is at the core of everything that we need to do to really enhance and improve the quality of service delivery for our community. With this roller coaster ride of opening and closing of schools, opening and closing and quarantining of cities, our community have felt the mental health of our community has been really put at risk. And what we have done at CHCF is we have attempted to continue to provide them with as much quality information as possible. They say that knowledge is power. So when we talked about hybrid models, opening and closing of schools, what does that mean? What are your rights? What can you do for your child? How can you make an informed decision? So we had a plethora of meetings with parents and with the administration of the different schools to be able to engage them in what was the best in the interest of their child. The second thing is, once the vaccine and the COVID testing started, where do I go? Right? So we had to pivot to tell people, this is where you go to get tested. These are the places that are available in your community. And doing workshops around that, what does that mean, and what does a false positive is attributed to? But the work that we do as far as youth development and after-school programming, we had to do it virtually. But a lot of those science experiments, how do we do them if you're home and I am in my house? So we had to start to learn to ship STEM kits and other important information to the child's home so that we could virtually take you through the process of creating a rocket, of creating toothpaste, of learning about technology. So that was a shift. The child development accreditation that we do for our providers, we had to do them virtually. How can we do that? How can we be responsible and at the same time be responsive? So those are some of the things that we had to do. When it came to the vaccine and the time, and Karina mentioned it, to tell our communities how important the vaccine is, with a charged political landscape, a lot of people either believe that you're saying it because you're a Democrat or you're not saying it because you're a Republican. To that end, we put together a panel of doctors, an international panel, because we wanted to say to our community, this is not politics, this is science. Don't hear it from the Department of Health only. Don't hear it from the CDC. We had doctors from Argentina and other places that are saying, listen, this is worldwide. These vaccines are safe. The vaccines are important. And these vaccines are needed for us to start moving to a place of normalcy. So that's how we had to shift some of the program that we did to align with the needs, specific needs of the community in this day and age.
Ramon, that's great, and thank you so much for doing that and for helping the children of New York. And I know that so many of our member agencies are trying to deal with the same concerns that you are. So hopefully that you can share some ideas and strategies with them. Unfortunately, I've talked too long, and our session is now up. So I do apologize, but I do want to thank all of our panelists for such an incredible job. To Brian, to Ramon, to Karina, thank you for this really insightful comments. And I want to also remind folks that immediately following this session, we want you to join us for our next session, which is kicking off right now at 2:40. Oops, I'm already 2 minutes over. And which will focus on the role of Latino community-based organizations in the COVID-19 recovery. To get there, of course, you want to click on the little doorway on the bottom left-hand corner of your screen. That'll bring you back to the main page, and then just click into the next session. Gracias, and we will see you at the next discussion. Thank you so much. Bye-bye.
Operations for the Hispanic Federation. What a great summit we've had so far. Thank you all for joining us. I'm excited to kick off this final discussion focused on the role of the Latino community-based organizations in COVID-19 recovery. I'm joined by nonprofit leaders and panelists, Oscar Chacon, who is the co-founder and executive director of Alianza Americas in Chicago, Monica Ramirez, founder and president of Justice for Migrant Women, Angelica Salas, the executive director for the Coalition for Human Immigrant Rights, also known as CHIRLA. Welcome everyone. Before we kick off this conversation, we'd like to share some brief remarks offered by U.S. Representative, the Honorable Jesus Chuy Garcia. So we'll go ahead and hear from Representative Garcia.
Saludos, and thank you for inviting me to join you today. The work the Hispanic Federation has done to support the community across the country and in Puerto Rico deserves recognition, and I'm proud to be called your ally. This past year has been tremendously challenging for all of us, but for undocumented worker, it has been particularly deadly. Nearly 5 million essential workers in the United States are undocumented immigrants, and almost 1 million of them are dreamers. Almost 2/3 of those essential workers serve in frontline jobs. They are nurses, doctors, grocery workers, and farm workers. They work in restaurants and meat and food processing plants. They take care of our children and our seniors. They are the frontline workers who have kept our country moving. Without the choice to work from home, they have endured unsafe working conditions and COVID exposure. And if exposed, many are scared to seek medical attention and even reluctant to seek the vaccine because of the fear of deportation. Immigrant communities have been struggling to make ends meet, feed their families, and pay rent while grieving for the loved ones they have lost. Despite our best efforts in the House of Reps, millions of undocumented workers were left out of crucial relief from the CARES Act passed last Congress. But we're finally seeing light at the end of the tunnel, and immigrant workers will finally receive some of the help their families need. Now, thanks to President Biden's American Rescue Plan, that his families qualify for stimulus checks of $1,400 per adult and child. For families with a tax identification number, ITIN number, the child tax credit will bring $3,000 per child, 6 to 17 years old, and $3,600 per child under 6 years of age. Beyond addressing the immediate health and economic crisis caused by COVID-19, we have a lot of work to do to re-envision our immigration laws and reverse the damage done by the previous administration. President Joe Biden introduced an immigration bill during his first 100 days in the White House to fix our long broken and chaotic immigration system. And last week, 2 key immigration bills were passed in the House of Representatives, the Dream and Promise Act and the Farm Workforce Modernization Act. Now the Senate has to do its job to pass these bills. But we need to do more. That's why I have reintroduced a new way forward, which gives us a historic opportunity to end the criminalization of immigrants and end the scourge of family separation. At this moment in history, we're called upon to uphold our values of compassion, common humanity, and racial justice. Decriminalizing immigration is not a radical concept. We are simply asking for fair treatment in our immigration system. This is the moment to reimagine an immigration system rooted in justice and compassion. We owe it to our immigrant brothers and sisters. Sí se puede.
Thank you, Representative, for your message and for your continued advocacy for our communities, particularly our Latino immigrant communities across this country. And we'll definitely have an opportunity to talk about the ways in which local organizations are going to be thinking about ways that we can reimagine not just our immigration system, but so many systems like our health system and our education system that have been, as we've talked throughout the summit, that have been impacted by COVID-19 and particularly communities of color. So well, I'm really excited to get us going. We only have a short period of time, lots of things to cover, so we're going to just dig right in. We're going to start by talking a little bit about how you all have seen both your organizations and other Latino-led and immigrant-led organizations really address the fallout of COVID-19. Can you shed some light into the ways in which Latino community-based organizations have had to fill in the gaps in order to address the economic and health inequities that COVID has exacerbated in our communities? And when you do that, when you answer that first question, if you can also just introduce yourself as well to our audience here today. And let's go ahead and let's get started with Angelica.
Good afternoon, everybody. Well, I have to say thank you to the Hispanic Federation for being such a true partner during these such difficult times for our organization. I am Angelica Salas. I am the Executive Director of CHIRLA, the Coalition for Humane Immigrant Rights. And CHIRLA's mission is to create a just society fully inclusive of immigrants. And CHIRLA is a mass membership immigrant rights organization that does direct organizing of immigrant workers and immigrant youth. We do policy and advocacy at the local, state, and national level. We also do a massive community education across the state of California. And then we also engage our community in civic engagement because it's important for their voice to be lifted up. But to your directly to your question, I think that immigrant rights organizations and Latino organizations in general have really had to step up and fill the gaps that the government is unwilling to fill. And so in this, what we saw right away was that as we were entering into a pandemic, our communities were consistently invisible to the planning of how to actually withstand this pandemic. Invisible to their needs, invisible to their pain as well, because many of them were also losing jobs. But unlike the rest of America, many of our immigrant brothers and sisters, and I would say, here in California and in Los Angeles County, many of those impacted were immigrant women who lost their jobs. But unlike everybody else, they didn't have access to unemployment benefit because of their immigration status. So there was no safety net for them to fall on. There was really nothing but the support of organizations like ours and their potentially their church, their union, but really nowhere else were they actually able, in the initial run, able to access some of the vital services they were needing. And even as we were trying to respond and transform from this virtual reality into, to serving our community, knowing that most of our community really depends on the face-to-face, even as we were doing that and trying to provide those services for our community, we were busy advocating with the federal, with the state, and with the local government in order to ensure that our folks were actually included. And so through those efforts, we were able to push our state government, and certainly here in California, to provide disaster relief assistance to the undocumented. It didn't even come close to, obviously, what was being offered at the federal government, but $500 at a time, it made a difference for individuals to be able to stay in their home, purchase food, and pay utilities. And that continues to this moment. I really feel it's important for us to understand that during a pandemic, there is no discrimination based on the healthcare of your health. The pandemic is going to hit people irrespective of your race, your gender, your immigration status. Yet we were creating policies that were actually excluding individuals. So just for us, it was important that we as an organization offer the support that our families needed. And I also just want to end with saying that the other element that was really important was that most of the platforms that were being set up in order for individuals to access services were actually digital. They were through the internet. So many of the families we serve do not have access even to a computer, know how to use a computer. Their literacy offline is still, maybe a 6th grade education at most. Getting them online and to try to access those services was very difficult. And so therefore, that's why we continue to be right there with our families in order for them to be seen during this pandemic, especially since they have suffered so much. So we want their pain and suffering to be seen, but also their needs to be seen during this time.
Thank you so much, Angelica. And I think you brought up some great points, and a lot of the things that we're hearing from members that the Hispanic Federation works, over 300 members across and partners across the country, right? And a lot of the same issues that you're bringing up, we're hearing throughout, and we've of course documented in that report that we released today. Monica, can you share a little bit?
Yes, thank you so much. And it's a real honor to be here with all of you. I'm grateful for all the work that you are all doing around the country. I mean, it's taken all of us to get to where we are now, and we certainly have a long way to go. I am the president and founder of an organization called Justice for Migrant Women. I want to start out by wishing you all a happy National Farmworker Awareness Week, which we kick off today. My organization focuses on the rights of migrant women workers, including farm workers. I come from a migrant farm worker family, and I'm based in Ohio, and our organization works across the country, serving the needs of farm worker women as well as other migrant women who move for the purposes of work. And we now know that that isn't only in agriculture, that's for many other jobs. And, I think that coming from a farm worker family, myself and other team members, we felt an immediate sense of fear when the pandemic started to reveal itself, because we knew instinctively that our community would be left behind, and that if we didn't step in, that there was going to be immeasurable trauma, and that we were going to lose a lot of people in our community. And unfortunately, that has been the case. But I think that perhaps one of the most important things that we've been able to do over the course of the past year, and certainly at the start of the pandemic, was that we started to reach out to our community to just say, are you okay? And what do you need? And what's important to you? And do you even know what's going on? And what we heard from farm workers around the country was that they didn't know what was going on, that they were called essential, they were given a little card, and they were told that they could keep going to work, but they didn't know much more. And their lives were basically turned upside down overnight, like the rest of us, except they had to continue to work and face real risks and balance trying to figure out how to educate their children, making tough decisions about whether or not to take their children with them to work in the fields and expose them to those dangers, or leave them at home by themselves. Like, the farm worker community and other migrant women were faced with constant, difficult choices throughout this pandemic. And those are choices that they've been, had to make throughout their lives, because we know that there's always so much instability for our communities. And this pandemic only further highlighted the ways in which the systems were not built for us and certainly weren't serving us. So in addition to just having those check-ins, and we started having a series of town halls with community members, which became really important because it allowed our work to evolve over the course of this pandemic. We moved to create a pandemic relief fund. As Angelica was saying, just having those resources available to buy food. I mean, I think one of the most heartbreaking things that we learned really early on in the pandemic was that while farm workers were continuing to work hours each day to feed us, they were going home and they didn't have food. And so our fund was created in order to provide farm workers with food and with other basic necessities. We also created a masks project because farm workers were talking to us about the difficulty they had in just accessing masks, and in places where masks were being required, where they couldn't even go into a grocery store or some other location without a mask. They just didn't have them. And they were, going to work, and they were still having to breathe in the pesticides and all the terrible things that farm workers breathe in every day. But on top of that, with the risk of the pandemic and the virus. And so we created the Farm Worker Mask Project. And our humanitarian work has just had to move as the community has called on us to move. And thankfully, we've been able to work closely with organizations like yours. And I know on the ground in Puerto Rico with Hispanic Fed, because we've been able to serve the needs of farm workers in 35 states and in Puerto Rico through our network of allied organizations. And one of the things that we've learned through this process is that in addition to just basic needs that aren't being met, there's so much mental health stress on our community. So one of the latest projects that we've been developing is focused on the mental health and well-being of the farm worker community and trying to help folks manage this crisis to the best of their ability. Like Angelica was saying, we've also been engaged in conversations with political leaders about not only how they left farm workers and other immigrant workers out during this pandemic and have called them essential, but continue to deny them essential rights and benefits, but we really stress the fact that farm workers, domestic workers, and other workers have always been denied rights. And we can't pretend like this situation just caused these problems. The reason that our communities have been so vulnerable is because our communities have been marginalized and targeted for a long time. So those conversations are continuing, and you know, we just really are grateful for the allied organizations that we're working alongside, because together that's how we've been able to surface some of the most pressing concerns of our community.
Thank you, Monica, for sharing. And yeah, happy Farm Worker Awareness Week. I know that here in North Carolina, one of our partners, Student Action with Farm Workers, has been reaching out about making sure that that's happening here in North Carolina, and I'm sure all over the country. So thanks for your work on that. Oscar, you want to close us out on this question?
Absolutely. Well, first of all, let me tell you that it is an honor for me to be here. I'm grateful for the invitation to be part of this panel. We have been for many years a close partner to Hispanic Federation, and it is a partnership that I only hope that will grow even stronger as we go by. Alianza Americas is an umbrella of national nature, which basically brings together Latin American immigrant-led organizations throughout the country, 55-member large nowadays. And I want to echo very strongly everything that was already said by both Monica and Angelica. I won't repeat. I will point out, though, that the role of community-based organizations within the Latino community, and more specifically within Latin American immigrant communities, is absolutely crucial. I mean, we are in many ways the equivalent, of Black churches for the Black community in the U.S. And it is important for us to make that be known as much as we can, because one of the things that we need to realize is that community-based organizations at the beginning of this COVID crisis were not in any way, shape, or form adequately prepared, to deal with the realities that we've been facing over the past year. That is because of a lot of the things that were already said by Monica and Angelica. Let me remind everybody that Latin American immigrant-led organizations and Latino-led organizations in general have been neglected for decades when it comes to philanthropy in the US, when it comes to government contracts money. And we have a major deficit that was already real before COVID hit. And so we had to come from way far behind to be able to adapt very quickly and deal, with the fact that we were indeed beginning from a very far away from ideal conditioning as far as coping with what COVID was bringing, which is frankly nothing short from a major assault on the life of many Latinos in the US, which is why we are among the top people affected by both infections, but also death. And I think it is important to highlight that very much, because going forward, we cannot go back to where we were prior to COVID. We need to absolutely become good practitioners of the notion that we must build back better together. And I think that implies also shifting dramatically the way we go forward about how we support Latino-led, Latin American immigrant-led organizations across the nation. Let me point out very strongly, and I'm echoing to a degree here something that was already said, but the fact that people without documents in the US, immigrants without visas in the US, have been systematically excluded. And I am happy for the changes that were made, even with the last relief package passed last year, but even more so with the one just recently passed. But this is still a serious attempt to undermine Latino health in the country when people without documents are excluded. Let's remember that nearly 80% of the undocumented population in the are Latinas and Latinos, Latinx. So when immigrants without papers are excluded, what they're really saying by and large is that Latinos are excluded. It's important to own that, to fight about that, and make sure that we don't go forward keeping these exclusions in place, which frankly are not just harmful to our communities, they're harmful for society, because every single specialist can tell you that when you leave intentionally a block of people out, then we are all going to suffer the consequences of that. So we are not really arguing just about us, but arguing about a better society, a better country. And the last point I want to make is that because of the reality of exclusion, of oppression that we were facing prior to COVID, which made so many people in our community not trust government at all, we are also facing a very serious challenge trying to persuade our communities to be able to indeed get in line for the vaccine. You know, in theory, everybody should be able to qualify for the vaccine. But when you combine long existing systems of exclusion with the totally understand the doubts that many people in our community have, we are in for a serious challenge, making sure that our communities get indeed included. And the very last thing I will say is you all have already mentioned it. Another panels also mentioned this. It is not just that we don't have access to internet. It is not that we don't have access to smartphones. The problem is having either one of those does not resolve the serious implications of the digital divide that has affected our communities and that has made many of our own organizations having to completely change and become tech savvy to be able to teach not only how to use Zoom, but how to properly use smartphone with so many people in our communities. That was one of the main things that we were able to do, in part with Hispanic Federation support, to invest in providing leaders in community-based organizations with basic tools for them to be able to know how to navigate this moment, but also how to then translate this knowledge and skills to the communities they are serving. And so I think that we have our work cut out, and I only look forward to more partnerships across the board that can ensure that Latino communities, once and for all, become truly part of the American family.
Gracias, Oscar. And I think that you brought up some amazing points, and I think a lot of the folks here who are watching this panel are echoing a lot of these sentiments as well by just the reactions that we're seeing. And I think that something that you mentioned about how do we make sure that we re-envision, right, how we build back better as a community. So that takes me into my second question, which is around, this American Rescue Plan that we've been talking about during the summit, and that has been a huge piece of legislation. There's a lot of executive directors here, a lot of folks that work with Latino community-based organizations that are hearing us today. How are CBOs going to be able to benefit from this American Rescue Plan, and what should they be aware of to make sure that they're able to take advantage of those aspects of the bill that could potentially really help them continue to further their mission of serving and really helping their local communities? And we'll start off with Monica this time.
Great. Well, I think that, it's really important for all of us to know that in this bill, there are a lot of different monies that will be available to help with a lot of important services. First, I think that to the extent that we all care a lot about culturally appropriate and linguistically appropriate tools and information, particularly given the gap in information that actually can reach our community, money that's been put into the bill for the CDC for outreach is going to be really important for us to figure out how to access. You know, I've been saying all along that it is one thing to say that information is available, and it's another thing to actually make sure that it reaches our community. And so those dollars going to organizations like ours that are trusted by our community and can make sure that the right information gets to our community will be critical. I just want to put a fine point on something that Oscar said that I think is super important. You know, as I've heard people talk about the hesitancy of community members to get tested or to get vaccinated, sometimes I hear this tone of judgment, like it's absurd that people wouldn't want to get tested or wouldn't want to get vaccinated. And, you know, as Oscar pointed out, why would they, with all of the things that they are already afraid of and all the systems that have already harmed them? You know, there's so much concern about what it will mean to come forward to get help, particularly after an administration spent so much time trying to do everything that was in its power to make our community become public charges so they couldn't later get benefits, you know, if there were to be an immigration bill. So it isn't absurd. And it's really, really important that we be able to do the work with the right resources to be able to get information to people about how to get tested and how to get the vaccine. In the farm worker community, one of the big things that happened was that as the cases of COVID were increasing, the resources for community health centers was falling and community health centers began closing. So this bill will provide more resources for health clinics to do vaccine education, to help administer the vaccine, and also testing. And there will be a great number of resources that will reach rural community members, which there's usually a pretty big gap when it comes to rural healthcare generally, but at least there will be some resources there for the rural community. And I think that one of the other important pieces that I want to highlight for those who are following along, who maybe also serve the farm worker community, is that the migrant Head Starts were one of the hard hit programs during this crisis. And many of our families look to migrant Head Start for information and for food and for other basic items for their families. And thankfully in this bill, there will be, I forget the number off the top of my head, it's quite substantial. It's $1 billion actually that will be moved towards Head Start programs, and that will include migrant Head Start programs. And so for folks who are working with Head Start aged children, you should know about those resources too, because you know that will be an important point of contact for our communities.
Thank you so much, Monica. And I think you bring up a number of ways in which local organizations can really think about how they're going to engage with this new bill, and the Hispanic Federation will continue to share resources and information out. Oscar, let's go with you, and then we'll finish up with Angelica.
You know, I believe that it's important to plan ahead, but more important than anything else from our point of view is to make sure that communities know what is in this particular new law, because there is so much need for literacy. You know, we are actually having this very afternoon the very first of several workshops geared towards community leaders, so that people can really understand, you know, what's in it, because it's such an expansive law. I mean, very expensive, let's face it. $1.9 trillion is a lot of money. And what we need to make sure is that we get the fair share that our communities deserve. And that means, you know, for many government agencies to really challenge themselves to truly be inclusive of Latino communities in the proportion, you know, that we need to be included. When contracts are being awarded, it's going to be crucial that they look up who's actually getting these resources. Because if we really want to go seriously about building back better together, that is what it takes. You know, changing who gets the resources, who actually know Latino communities can be in a better position to do it. And I believe we are, you know, already going in a good way about it. I am proud to let you know that we recently received a CDC grant that will allow us, among other things, to produce content about vaccine and its importance in multiple indigenous languages, in Garifuna, and of course in Spanish. You know, because a lot of people talk about Latinos as if we are all exactly the same and we only talk Spanish. We don't. You know, we are extremely diverse, and it is important that we understand that complexity, that diversity really means. and make use of every possible opportunity, every possible asset that this particular law can actually bring into our community so that we can make a difference for Latinos. And of course, I mean, there is so much more to be done. The last thing I will say is, I am a little bit concerned that a lot of people may believe that just spending a lot of money somehow will land us to a new reality economically, socially, politically, culturally, and it doesn't. I think it is important to understand that alongside with a lot of money, we really need to do a better job imagining the kind of inclusive, equal, sustainable society that we really want to contribute to build for the future of our communities and the future of the Americas, because we are incredibly linked with the realities of life in Mexico, Central American countries. And if we keep ignoring that, we are simply shooting ourselves in the foot.
Thank you, Oscar, for that. And I think that for those folks who are interested in learning more about the workshops that they're having, please make sure that you follow Alianza Americas. So Angelica, you wanna close us out on this question, and then we'll have one more question before we end this panel.
Sure. Well, what I want to make sure everybody who is here does is actually follow the money. There's monies that are going to stay at the federal level. There's monies that are going to stay at the state level. And then there's those that are going at the local level to our counties, our cities. And so we need to make sure that we actually follow the money, because it has been described, the American Rescue Plan has been described as transformative, but it will only be transformative if those resources actually get to our communities and they get to the Latino community. What I saw with the CARES Act is that a lot of money was withheld for some time, and then as the as the end of the year approached, all of a sudden there were magically all these resources appeared to help our community. But then everything was being done last minute. So I want us to make sure, I think it is our responsibility to follow all these resources that are for child care, that are for our schools, that are, that can make a huge difference. But I think the first piece is to really create a community of advocacy and watchdogs that are looking at how these resources are being spent. The other thing is that I want to remind everybody that in the American Rescue Plan, we continue to leave out the undocumented. So over 9 million individuals were left out of this American Rescue Plan because they do not have Social Security numbers. And that, yes, there are resources for mixed status families that they should have gotten in the first place, and for our children. But the undocumented community still doesn't have access to resources. So there are some waivers and some abilities to maybe expand some of these resources across the board for small businesses, as well as for some of the youth. So we need to make sure that we're advocating at the local level, that where there is possibility, that our community completely be included. And I think that is just important for me to include. There's going to be other rescue plans and economic, to build back this country better. And I like that you add, Oscar, together. I want to make sure that immigration reform and immigration justice is included. There is no way we can continue to live in this country with so many of our brothers and sisters completely marginalized and utilized. And that's the problem, is that we are leave people out, but yet extract from them their labor, their everything. And I think that has to stop. And so we as a community have to make sure that in any future plans that are, we continue to demand that immigration reform and justice be part of those plans.
Gracias, Angelica. You led me into sort of my last question for this panel, and I wish we had more time to dig deeper into a lot of the things that you all brought up, and we hope to continue these discussions in many different ways, right? And so one of the things my last question, many of us in our communities are seeing some small light at the end of the tunnel when it comes to getting this virus under control this year, but yet we know that the people that we're serving, particularly folks of color, low-income families, will continue to hurt for many years to come. And so how can you sort of share and sort of some insights into how CBOs, community-based organizations, can work long-term to address the impact of COVID, and what kinds of things should they be thinking about when talking to local, state, and federal governments about programs and policies that they should consider to help deal with the long-term fallout that COVID is inflicting in our communities. And we know that a lot of CBOs are engaging in advocacy efforts and thinking about not just this new bill, but many more to come, and also at the state and local level as well. So let's start with Oscar this time, and then we'll go around with Angelica next.
Well, I think that one of the opportunities and yet also challenge that we have given this moment we are in is to really challenge ourselves in the sense of not being content with simply providing services to our communities. I think that the ultimate task that we need to undertake, and it is an opportunity to transform in many ways, is to really tackle the ultimate question about how can we really be enablers of our communities so that we can become much better organized, not only to be very strongly in line to claim what we deserve to get, but also be better organized politically, be better organized electorally, so that we can actually become a much stronger portion of our society, able to indeed make sure that we no longer are excluded, that we no longer are mistreated, that the record gets to be set straight. For example, on something like immigration, we continue to argue as immigration is some sort of a burden or a liability for the country, when exactly the opposite is what the truth and the evidence tell us. So I think getting ourselves organized and challenging every organization in our community to go beyond just providing services and actually foster organizing in creative ways, I believe is the way that we will ultimately make a push that will allow us to be where we should be, and we're not there yet.
Thank you, Oscar. That's very insightful. Angelica, what can you add?
Well, the first piece is that we have to remember that not all our community still has access to healthcare. And even after we've gone through this horrible situation where we have lost so many of our loved ones, and my condolences go out to everybody in the room, because I know that you know somebody, because this is a Latino space, and so we know people we love dearly who we have lost. And so as we move forward, we have to ensure that everybody has access to quality healthcare. And this matters so much even after right now, after the pandemic, and even as we have had a lot of people who maybe did not lose their lives, but they have lost their health. So they're still dealing with the consequences of this disease in their bodies, and some of them won't be able to work. They overcame it, but they have been left with lingering symptoms. And so it's important for us to really, as a community, advocate for full access to healthcare independent of immigration status, so that our folks can actually now take care of their bodies and their health and their families in this phase. So I think that's something that's very, very important. We need to ensure, even as we speak, that vaccination continues to go to our communities. I was just this morning in a press conference where we had to bring up that some of these for-profit entities that have gotten some of these contracts for vaccination are turning away our folks. We cannot allow that to happen. And I want us all to understand, and we have to say this, we deserve to live just like everybody else. And so we need to ensure that vaccination comes forward for our community. And so these are opportunities where it is an opportunity because people have witnessed what we have known all along. They have witnessed the inequities and the exclusions, and now we have to compel the society to ensure that there are resources and that they invest in us the way that we should always have been invested in. And so I think that even as we come out of this situation and that we've suffered and seen so much pain, it also should fortify us and also give us the strength to even be stronger advocates, as Oscar has added with his comments as well.
Gracias. Thank you so much. And we're going to end soon. So just Monica, can you close us out for this particular session?
Sure. I mean, I think for me, it's important for us to remind ourselves that we've got each other, and we're going to have to help each other a lot going forward. We're not competition. We need to help each other get those funds. Some of our organizations are not as well positioned to apply for those funds, and so we need to figure out how amongst ourselves we help each other access those resources. We need to understand that aid isn't short-term, it's going to have to be long-term, and we need to think about it that way, and we need to come up with systems so that we can get the community members ongoing aid. We haven't talked about this here, but we need to say it. 1 million Latinas have been pushed out of the labor market during this pandemic, and we need to figure out how we're going to support Latinas to get back to work, and to get back to work so that they are at the same position or in a better position that they were before. We were already over 200 years behind on closing the pay gap for Latinas, and this pandemic is going to put us even further behind. So part of our plan has to be around how we are going to support Latinas who are at the center of our families, our communities, and our workplaces. And I look forward to working with all of you. We have a lot of work to do, but I know that together we're going to make a difference.
Muchas gracias, and thank you all again. Gracias, Angelica, gracias, Oscar, gracias, Monica, for your time and for your wisdom and for sharing all of the knowledge that you have. You know, I was taking some notes, and this idea of how do we become better organized, how do we expand access for our community, and how we support each other. Those are some of the high-level things that I got from that last question, that those are going to be critical in order for us to continue to build a more equitable future, a more equitable country for our communities in our future generation. Thank you so much. Immediately after this session, we are going to invite you all to join us for our virtual mixer, where you will have the opportunity to network and connect one-on-one with other attendees, some of the panelists and folks from Hispanic Federation. The Run the World platform will introduce you and match you with someone new every 5 minutes. So make sure that your camera ready, you have your big smile on, and you are ready to just get to know someone, right? And talk to them about what you've learned today, and how we can continue to support each other through this difficult time. But before we get to that, I would like to introduce my colleague, Ingrid Alvarez. Many of you heard from her earlier. She's the Hispanic Federation's VP for Policy, who will close this formal summit. And so we'll see you at the mixer. Gracias. And Ingrid, I'll let you take it away.
Gracias, Daniel. Gracias to our panelists. Hello to our entire audience this afternoon. My name is Ingrid Alvarez, and I am the Vice President for Public Policy and Strategic Engagement at the Hispanic Federation. Thank you to everyone today for this important summit about the economic impact of COVID on our Latino and immigrant communities. We had a chance to hear directly from some of our strongest champions in Congress, Senate Majority Leader Schumer, Congressman Garcia, and Congressional Hispanic Caucus Chair Dr. Ruiz. You also had a chance to hear from some of our amazing community and thought leaders who are fighting to ensure that the voices of our people are heard, as well as many of my colleagues here at HF, who you work alongside with to advocate at the local, state, and national levels, to uplift and care for our community, especially in times of crisis. We came together today, yes, to underscore the devastating impact of COVID-19, what the devastating impact of COVID-19 has had on our community, but much more so to break bread about solutions, about how we move forward towards a better future for all of our people. As we heard, the recently passed American Rescue Plan gives us hope and something tangible to build from. It provides a lifeline for millions of Latinos and other Americans, ensuring that they can keep their jobs, incomes, and their homes, enabling parents to support and feed their families. It provides much needed childcare support, emergency rental assistance, state relief aid, and monthly cash payments for low-income parents. The child tax credit alone will largely be responsible for cutting childhood poverty in half in 1 year alone. It is, in short, the most progressive piece of legislation we've experienced in generations. But obviously, one bill is not enough. We must ensure that many of the critical provisions in this bill become permanent. It is up to us to make sure that our members of Congress and the White House make that happen and pass other much needed, bold and progressive bills that will address the historical and systemic inequities that COVID-19 has exacerbated and laid to bear. Our work is far from over. We must continue to speak up, to take action, to let our elected representatives know not only what we need, but what we expect. We look forward to being with each of you in this fight. We know that if we do this together, our communities will win, and our country will be better and stronger for it. Gracias. Thank you.